Now, I spoke to some of you while during the break. So tonight, what we're going to do is it's Testimony Thursday. We have these sometimes, and I'm really looking forward to some wonderful testimonies from people. I've heard some astounding ones in the past week, and I know there are pretty good ones coming up as well. But what I'd like to do is just make a disclaimer up front and just briefly explain how the main patch X39 works. So X39, well, firstly, all the patches work with our infrared light. They work with photobiomodulation. They reflect the light back in, and they activate a particular peptide. And it works off light therapy that then naturally activates areas in our bodies. Like the X39 will activate the copper peptide, specifically GHKCU, which reactivates dormant stem cells. It's not the patch, but the stem cells that go to work, your own stem cells, that then activate whatever healing there is. So LifeWave products are not intended to treat, diagnose, cure, mitigate, or prevent any disease or medical condition. So the way we're going to work this evening is, I'd like to see who's interested in sharing a testimony with us, please. So if you can just raise your hand, and I will slowly call on different people, please. And then I'll just ask you to unmute, and if you can proceed. Georgie, would you like to unmute and continue? Now, let me see. Do I have to ask you to unmute here?
I've managed to.
Yes, fabulous. Thank you.
Okay, now you're not supposed to say unmute. I mean, you're not supposed to say your hands up, okay, go. You're supposed to like, give me a chance. You're supposed to say, oh, okay, there's Georgie and there's Pamela and there's whatever.
Okay.
And okay.
But I'm ready. This, as you can see. So let's just go through and see you all there. So hang 10. I see Pamela's got her hand up. Let me just look at all the others. Yes, maybe. Goodness gracious, where are the others? Zarina, I think that you have a testimony. Ilza, I think you have one. Sandy may have one. Ondine may. And there's some others. So Pamela, I will be asking you later. They are
Charles has got a physical hand up.
Oh, yes, thank you. And I'm pleased there are others. So Georgie, help me with this as we go through. But, you know, maybe, should we start with you, Georgie? But let's just make a note of some people. So, yes, Georgie, I heard yours last week, and I was gobsmacked. So I'm delighted you're here, and you're happy to share with us. What a change. Thanks, Georgie.
Thank you so much, Sandy. Thank you to X39 family. It's so lovely to be on a call as a community since our conference in December, and Happy New Year to you all. I haven't been called for a testimony before, but when I went to the presentation on Tuesday at Bryanston, Sandy just said, does anybody have a testimony? And I really, really felt compelled to share mine, because, you know, testimonies are amazing. Somebody is going to hear what they want to hear and what they need to hear to make a decision. So I had my first nervous breakdown in 1994 and was very, very quickly prescribed Prozac for my nervous breakdown and told by the doctor, don't worry, just be on it for 3 months and then you'll be fine. Which took me on a journey for the rest of my life, being given antidepressants for my problems, which would go away after a certain period of time. It didn't, because I ended up admitting myself to rehab for three times myself, because I just could not cope, no matter what medication I was on. And fortunately, in rehab, you see a psychologist and a psychiatrist every single day, and they monitor with blood tests and other tests on a daily basis as to how you are managing. So I finally managed to get onto the proper cocktail. But during COVID, I actually lost everything. I was evicted from my home and ended up staying in a commune with other older ladies, and eventually relocated on a whim to another province to go and get a job, which I got for 6 months working for a narcissist, which was absolutely devastating for me. And I'm still on my medication at this point in time. I returned to Joburg and have some amazing friends that supported me and helped me pay my bills and everything, till eventually I decided that it was time to commit suicide. I had so many different reasons. No, I had one reason, but I had so many places to do it, where to do it, how to do it. But I eventually, a very, very dear friend of mine took me under her wing and helped me bring my confidence back by putting my CV together and trying to get a job. I was able to get a job, fortunately, in the grief and funeral industry, which suited my personality perfectly at that time, because I was so down and so out. So dealing with grieving people, no matter how energy draining it was, that's how much energy I had. I had energy to listen to people. So after a 3-year stint, 2.5-year stint of being a funeral planner and grief support person, my dear friend Brigitte from Switzerland, who I've known for many, many years, going back to the 2013s with Lucinda, called me and asked me if I knew about X39. I went to a presentation at Bryanston and instantly signed up. And after a week of being on X39, my anxiety and the fog in my brain lifted. It was a miracle. I felt like I was actually a real person. I didn't actually know who this Georgie was, because when I was reading my CV 3 years earlier, I didn't know who this person was in the CV. I didn't recognize her. It wasn't somebody that I knew. And when my I think it was 9 days actually on X39 that my anxiety lifted, I actually for the first time could say, oh my gosh, Georgie is back. I'm 9 months on X39, and it is the most wonderful feeling to know that I can function as a Georgie. It's like going back to being who I was, capable and able. So I just really want to thank David and Brigitte for the opportunity of patching myself. And I hope that this has helped somebody that they might know that would benefit. Thank you so much, Sandy.
Oh, thank you, Georgie. And you know, Georgie, I've seen you on and off, especially helping us organize the conferences and whatnot. And then I saw you, that you'd organized the funeral of this very close friend of ours. I couldn't believe it was you. And little did I know what you've been through and what you've been going through. So, you know, I always talk about, when I see results, this really feeds my heart and soul. And Georgie, huge hugs, huge hugs. I am so pleased that this is happening for you and that everything's improving. And I honestly believe that come the end of the year, you're going to see a whole lot more of your true Georgie soul. I really believe that, Georgie. Thank you, Georgie. I really appreciate it. Thanks so much. And you know, I'm just going to break here. Yes, people are loving it. You know, when I started, Chris explained it to me briefly, and I was delighted because my practice runs on frequencies, not specifically light. But I'd known Chris for 10 years, and I knew his mom had been through so much. And I think most of you know the story of his mom. She'd been suffering with fibromyalgia for 16 years, and 3.5 weeks on X39, zero pain. Absolutely zero. And when I heard that, I thought it's my obligation to share this with everyone. But as I mentioned that, I want people to understand everyone heals at a different rate. Why? Because their stem cells go to work with a priority in their bodies. So, Georgie, once again, thank you so much. And Pamela, would you like to unmute yourself and tell us your story? Yes, and I was about to ask you to put on your camera if you could, please. Thank you, Pamela. So unmute yourself, Pamela.
Yeah. Okay. Can you hear me now?
Yes.
Yeah. Okay. Well, I'm a holistic midwife and I love the whole concept of these patches. I've used it for myself and I've lowered my blood pressure, and that's great. But what I wanted to give as a testimonial, I have a grandchild. He's 5 years old and he has abscences, which is a form of epilepsy. So he can just disappear for between 5 and 10 seconds. And I just decided that he needed to go onto the patches. Now, I know they say you need to go onto the X39, but he's young, so he has stem cells. And I just tested him by kinesiology, and I put him on the Aeon. And since he's been using that, he doesn't have any more absences. And so therefore, he was having between 30 to 50 5-second absences. By putting the Aeon patch on him, he no longer has them. Now, it's not to say that he doesn't disconnect. I still need to work on this, but it makes his life so much easier. And it's just amazing. And I will now be using the X39 with the Aeon to see how we can make it better for him. But even just with the Aeon, he doesn't have any absences anymore.
Wow, that's wonderful news, wonderful. And you know, probably we know that it works with inflammation, stress, and so forth. And it's probably been calming all of that. And I'm very keen to hear from you how it goes once he's on the X39 as well. And although he's young and he has these active adult stem cells, you know what I mean? I know one of the doctors who actually patched her grandson of 2 months old for a short time whenever she looked after him with great result. So Pamela, thank you. And how the family's life and his life must have changed.
Yeah, and so I just really love this whole thing, and thank you for everything, all this information. It's just lovely to be able to share with people.
It is. It is. It feeds the heart and soul, doesn't it?
Absolutely.
Thanks so much. Thanks, Pamela.
Thank you.
And Freeman, I see you next. Would you like to unmute and share with us?
Good evening. My name is Freeman. I'm based in the UK. Right. I got the patches in November. The main problem that really I had was my lower back. I used to have so much pain. And there's times I was starting to move, bending forward, if you understand that, like an old person. because actually I'm old anyway. Then I used this, I think within about 2 or 3 days, that pain had gone. And since then, I've never had that pain. Then the other thing that I noticed is I used to, when I'm brushing my teeth, I used to bleed quite a lot. And I remember when I went to the dentist, he was saying, you got this. I can't remember what the name of the is. So now with the X39, there's no more bleeding. I wasn't expecting that, but it's one of the things that happened. And then because where I work, I'm the oldest person. Everybody says, where do you get all this energy from? I say, I got my patches. So excellent, to be honest with you. I'm not going to get away from them.
Wonderful news, wonderful, Freeman. And you know what? I'm so pleased you spoke of your gums where you weren't expecting that. And this is so typical that one's own stem cells go to work in areas that we unaware are challenged at the time. Wonderful news. And you'll see other little changes in the next year or two. It continues to work. Thanks, Freeman. Thank you. And Paul, would you like to unmute?
Good evening, everyone. Yes, thank you, Sandy. I've got about 5 things that I can touch on. And I know sometimes when you do testimonials, you want to touch on one thing. But really in the sort of, I can roughly work it out to 5 months that I've been on X39 since my bike accident that I was involved in, which affected the right side of my face. I had to have 2 reconstruction surgeries. But let me first start with one of the main problems that I had before the bike accident, which was acid reflux. Now, acid reflux was that bad that they actually found that I had a hernia in my stomach that had to be repaired. And when they did the operation, they also found that I had a whole lot of omental fat, which was surrounding my organs that obviously pushes on my stomach. And that causes an acid reflux coming into my throat, which then is me coughing up blood a lot of the time because it causes blood in my esophagus. Now, that used to really wake me up at night, and it used to almost choke me to death at times because I could wake up and I couldn't breathe. So I used to really struggle with that. But I've found since I'm on X39, I don't have to take as much medication like your omeprazole tablets that you have to go and buy from the chemist. So I'm really cutting down on that. Only now and then when it really gets bad, then I still take a tablet, but I'm not on it like I used to be. And I know the relaxation I get just from knowing that from X39, it has helped. The next thing I want to talk on is 2 pains that I used to have a lot of. And they both came from sports injuries and active life injuries. Now, my 2 shoulders, the one I injured as a youngster riding racehorses. I wanted to be a jockey, but then I fell out of the jockey academy, but I still rode horses when I went back to Kimberley. The one day we jumped away from the 500-meter mark, and I was riding a colt, and it was a horse that still had its marbles, as we call it. So when I found the saddle so far back, I said, whoa, 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 whoa. This thing's going to start doing rodeo with me if I don't try and kick the saddle forward. So I grabbed the mane and I put the saddle as far forward as I could. By that stage, I got to the finish line, but now going around the bend, the saddle started slipping again. I fell out and I hurt my shoulder, unfortunately. The other shoulder, my left shoulder, I injured as a wicketkeeper behind the cricket field stump, and I dove too far and I dislocated my shoulder. So both my shoulders since my young days have not been normal. I can't lift them at times. I can't use them. I battle to keep them at a certain angle. So I've had that pain quite a lot where it feels like there's a pinched nerve in both sides. Since I've been on the X39, I've found that my shoulder pain has subsided. It's a lot less. It's not 100% gone, but it is a lot more manageable to move my shoulders at the moment. My back pain, similarly, I've also fallen off horses. I was in a car accident. I fell downstairs quite a few times. So my back has really been subject to a lot of different trauma, if I can put it that way. But the same thing. Because of my hernia operation as well, I couldn't bend down at one stage to tie my own shoelaces. That's how bad it was. I couldn't breathe because of the acid reflux coming up. But at the same time, my back was a problem. So the 2 together really made it difficult for me to actually bend at times to even do my own shoelaces. But I've found as well, since the X39, it's taking away a lot of that back pain as well. And I can move a lot better. I can twist a lot better. I can like do things that I wasn't able to do. I don't want to have to say I feel like a 20-year-old, but I suppose I could say I feel like a 20-year-old. Then the next thing, obviously being in the accident that I was in July, I can testify to the post-op wound healing that I believe that the X39 helped me get through, because I know from my previous surgeries that I've had before, how long it took me to heal there. And even since surgeries, like when I get injured and stuff like that, I know how long bruising takes to get away or wounds take to heal and stuff like that. I had 2 facial reconstruction surgeries. The first one took a little bit longer, but the second one, because I was on the patches for a little bit longer at that stage, the healing was a lot quicker. The doctors expected the cuts and everything to heal in 2 weeks. It was 3 days, and that stuff was together because the scar, plaster. Max Anderson, get rid of that person.
The usual, yeah.
Yeah. All right. So the scar, the plaster that I had on my face literally came off by itself. So in other words, the skin actually ejected it because it was healed so much that it just came off by itself. So the 2 weeks that the doctor told me that it should have stayed on, I couldn't keep to that because it actually came off by itself. So I was really, really surprised at the healing process that the X39 put me through there. And then obviously there's another thing that I've learned since I've had to Google, what is this feeling that I'm getting in my face half the time? When I don't have the patch on, there's a thing called paresthesia. It's a feeling like something is crawling in your face, like you either have a piece of hair or a spider or some ants or a cockroach in your face. It just feels like something is literally crawling in your face. And I have that feeling quite a lot on the right-hand side, obviously where they've worked and the nerves have been damaged. So when I do wear the patch, I find that that feeling isn't there. But the time when I don't wear the patch, then that feeling sort of comes out. So I know that the patch itself is helping with that. So that's just, if I can put it in a nutshell, you know, the 5 little things that I can touch on that it's helped me with. There are a few more other things that probably I'm not aware of that it's probably working on in the background. But for now, I do believe I'm feeling a lot younger. I'm feeling a lot better. I'm feeling a lot more healthier than I was before the accident. So I really, really appreciate Wilson. I appreciate all of you that are like there to motivate us as a team in South Africa to wear what we know is helping us with our health. Thank you very much, everyone.
Thank you, Paul. Goodness gracious me. You've been through the mill. And I can feel your energy. It feels like you're going to climb out of the screen to tell everyone what's happened. I'm so happy. Thank you, Paul. Thank you. And I see Dr. Ali's on as well. Welcome, Dr. Ali. I'm so pleased you're here. And I'm so pleased that Eric and I actually met you in person in Marrakesh. It was good meeting you. It really was. In fact, Dr. Ali was there, and we also had a homeopath, a naturopath. It was good meeting everyone. And Dr. Ali, I'll ask you to chat later, if you don't mind. Ilse, I'm so pleased you're on, and won't you please unmute and share with us?
I just removed 3 trolls. Okay, let's.
Thank you. I know that
stop.
Max Oak. Thank you.
Yeah, now he's gone. Deleted and reported. Okay, Sandy told me about our beautiful little patches about 2 years ago, and she told me about 3 times in that year. And then I had an eye operation in August 2 years ago, and I actually started to use the patches in February for my eye. But what it sorted out first was my circadian rhythm, my non-sleep, and everything from there. And so I started that in February last year. But for the first 3 weeks, I actually just wanted to sleep all the time. So I went to sleep in the afternoon. I went to sleep early. And then a friend said to me, just go to bed early over the weekend now. And I went to bed at 6 o'clock. And I only woke up at 8 o'clock the next morning, but that was about 2.5 weeks in with the patches. Now, I never, ever sleep for what was it, 12 hours or 14 hours all at once. And that was actually what really, I think, reset my whole system for my sleep. I mean, they say it's good if you wake up at 5 and go and do things and go and sit outside as the sun comes up. So it's that whole sleep pattern that got fixed. My eyes also both got fixed in the meantime, or not fixed, but both of them got better. The one that was operated on and the other one. I'm trying to go back to have my my multifocals done, but every time my eyes are better. That's now since January last, well, yeah, since February. So I went back in April and they increase every time. My reading glasses are down now from a 2.5 to a 2. So it's really been an incredible journey. Thank you, Sandy.
Yeah, thank you, Ilse. And you know, some people say when they start, man, I'm tired. But it's also part of the detox, the reset. I always say that's wonderful news. And I mean it because I know that from my practice. You know, once I've treated someone, they sometimes go through that and I'd say, fabulous news. Because something's working and we don't know exactly where it's working. Very good news. And no, you too energetic to sleep for 14 hours normally. For sure not. Thanks so much, Elsa.
Pleasure,
Thank you.
Sandy.
Hey, Sandy, can you shut your bitch ass up?
Pardon? Okay, I know some of you are onto this. I'm just going to mute all again. Let's do that. And then, please show me who else would like to. Yes, Charles. Charles, please. Remove Bikram, please. Take him out.
Okay, can you hear me?
Thank you. Charles, super. So
Can you hear me?
if you could just unmute.
I've just unmuted myself.
Karen, I can't do that, sorry. I would like to, but I can't, and I'm not seeing anything. Everyone just ignore that which doesn't serve us.
Hello? Can you hear me?
Yes, I can. Sorry, Charles. We
Okay.
were just sorting out some gremlins.
Okay. All right.
Charles,
I go
turn
ahead?
your volume up for us, please.
Let me just see what's happening here. My volume.
Oh, don't worry. Then talk, we'll just be quietly. I'm on maximum here.
Okay. All right. So can you hear what I'm saying? Can you
Yes,
hear me?
yes, I can.
Good. Okay. Yeah. I was looking for a business opportunity in 2020. Sorry, no, in 2023. And I came across Chris Hatting's compensation plan. And then I called him and I asked him, Chris, what are you involved in? And he said, I'll send you the information. And when I got that information about the X39, I thought, wow, this is what I really need, because I had sciatica for 50 years and I lived in constant pain every single day. And every night I couldn't really sleep. I used to toss and turn until I could go off to sleep. And my patches arrived on the 7th of November last year, and no, the year before last. And on the 7th of November, I patched myself 9 o'clock that morning, and I was a one-patch wonder. For the first time in 50 years, I managed to sleep pain-free, and I've never, ever had pain since then. But I've also had other health issues. I had a severe mental breakdown, and during that time I was hospitalized, And during that time, they mentioned to me and they said, you have dementia. And I was supposed to be going into an institution, but thank God my sister intervened and she stopped that from happening. And during the process of using the X39 and the other ones, the glutathione and the carnosine and the other patches, I noticed certain things were improving. I had glaucoma. I don't have glaucoma any longer. I had high blood pressure. I've gone off all my high blood pressure tablets. I've had prostate cancer. I don't have prostate cancer anymore. And I had diabetes. I'm off my diabetic medication as well. So it's been a real blessing, this technology that has come across my path. It would be absolutely criminal for me not to share it with anybody. So that is why I go out of my way to share it with people and blessing people every single day.
Wow,
You,
thank you, thank you.
Mommy,
And you know, remove AK, please. So Charles, thank you so much. You know, I've seen you on Zooms regularly. I've met you. And you know, it just shows we meet someone, we have no idea what they're either going through or have been through. And Charles, it is blessing people when you share what's happened with you. And sure, they may not get the identical results. Would you all agree with me? We are unique beings. And thank the Lord for that. That's all I can say. So we will all heal at different rates. Charles, I am so happy, so inspired by all these stories. And should we have any visitors on here, I'm sure that they're finding it as amazing as I am after 2 years of using the patches and working with them. I absolutely love what I do. And I believe all of you do too. You can't help but share it. Would you agree? It's better than sharing a good restaurant or a good movie. It's much better.
yeah. Shut up.
Remove Sue's Sue iPad, please. Thank you. Okay, this is so inspiring. Who else here would like to share? Dr. Ali, I'm sure you've got some stories that are seriously inspiring. And I know Tracy can share, I know Ondine can share. I haven't heard everyone's personal. Sue Homer. So Ali, may I please just ask Sue to share, and then Ali, maybe move on to you, please. So Sue, please unmute. It's good to see you again. Spoke with you last week.
Okay. Now, my story is this. I'm 77 years old. And I still donate.
Remove John's iPhone, please. Sorry, Sue. We have these disruptors.
And I donate platelets. I have done for the last 10 years. And prior to that, I donated blood since I've been 26. And when I was told that I only had 5% of my stem cells left, I really wondered what I was doing to myself. Anyway, when I donate, they look after me very well in the facility. They make sure that I have enough calcium. They make sure that my feet are up. I have had occasions where towards the end I've started to go dizzy, and they really looked after me. But I've been on X39 now for 4 months, and I've donated twice in that period. And both of them have been much, much better. In fact, after I get up and go get in the car
Remove Ian and Nintendo, please.
So once I donated last week, and I got up and I didn't even realize. Oh my God. There was no difference to it whatsoever. I just carried on as usual. I didn't even feel the exhaustion where I needed to go home and sleep or anything like that. And I can only attribute it to the X39 and X49 that I'm wearing every day. Thank you.
Wow,
Really
Sue.
enjoying this.
And you know, Sue, thank you so much. I listen to you and I can feel the vibrancy. We can feel the energy. And if I may say so, yes, you're not a youngster. You and I are not youngsters anymore. And for you to improve like that, I always thought that in South Africa, you shouldn't donate after age 65, because my husband used to donate. And many years later, they said, no, hang on, you must stop. So well done to you, Sue. And thank you for helping people, not just with the patches, but with your platelets too. Thank you.
Can I just say that when you donate the platelets, you actually only donate possibly about 100 mils of your own fluid, because you go through a machine and it takes about 2.5 hours, and they replace all the blood plasma. So in fact, for an older person, it's very much easier to do it that way. So they only take the machine actually sieves out all the platelets. So they only take what they need and put all the rest back. It's actually an amazing, amazing procedure. I welcome, and I have been told that I can go on. I'm O negative, so I'm very valuable blood. And they ask and they phone me. And when they phone me and I arrive and I say, we've got 4 babies waiting for you tonight. So that makes you feel good that you are going to be helping somebody straight away. You know, this is why I'm so pleased. It's such a privilege to be using X39 to go on being able to help people. It's wonderful.
Wonderful.
Thank you for allowing me to share.
I'm delighted you've shared. I really am. I am. I'm just going to pop over to Georgie. Thank you so much, Sue, for what you're doing with the platelets and the patches. Georgie?
Hi.
Do you want to unmute? Yeah.
No, I'm just clapping Zoom style because nobody can hear me. I'm just clapping.
Thank you. Thank you, Georgie. Thank you. Dr. Ali, would you like to share whatever?
Whatever. Well done, Sandy. You are showing such amazing leadership and cool and calm in the face of these hackers. I mean, you are amazing. We are just all so grateful to you, not only for hosting this when Chris and Lucinda are away, but also for that. So thank you. So I'm Dr. Ali. I'm a GP and functional medicine doctor in the UK. I have my own practice, Evolution Hormone and Functional Medicine Clinic, is a virtual clinic focused on women's hormones. And I'm also working in a private long COVID clinic called Dr. Finley's Private Practice. I work virtually there all over the world as well. So it's amazing to be able to do this holistic work, which I never dreamed of. And then adding to that the patches, I've just been able to start using them in the clinic, the long COVID clinic. So no results yet, but just getting started. Now, what I patched a community nurse with neuropathic pain who came into my surgery one time, and she'd had neuropathic pain for over 10 years in her leg. And it was really severe, and it was really affecting her life. And she found that the using IceWave and X39, the pain went away, and the pain went away totally. After 5 days of using IceWave and X39, she then found she only needed to use the X39. She no longer needed the IceWave because the pain had gone. So that was brilliant. She, of course, is a brand partner with me in the UK. Thinking of other people, there's so many cases. I'm usually citing the amazing testimonials from here and from the Telegram group. I think Chris has created for us all the most amazing resource. And I think it's really important that we remember to post our testimonials there as well. My husband had had severe hand pain for about 3 years. He was dropping mugs, he was dropping cooking that he was taking out of the oven. And on the third day of patching with X39 alone, that hand pain disappears. It only ever comes back if he forgets for more than 2 days, if he forgets his X39, which we all do incidentally. You know, we do forget. People ask, what if I forget to take my patch off? We've all done it multiple times. You just miss it out until the next day. If you forget to put one on, it's okay. You just put it on as soon as you remember the next day. You know, it's fine. And a lot of us are using them with our animals as well. So what other examples? The examples I've seen in the Telegram group are the ones that spring to mind. Yeah, so I've got a young girl who's having really heavy periods. She's probably got polycystic ovary syndrome, and possibly endometriosis as well, both of which are related to estrogen dominance. And she has found the SP6 to be very helpful with regulating her period. Now, another brand partner of mine, she has rheumatoid arthritis, and her hand pain was so severe, she was actually on the waiting list to have joint replacement surgery in her hands. Now, once she started using X39, she no longer needed that. The pain went away. So she's using X39, she's using Eon as well. And then, one of her contacts had such severe menorrhagia, that's heavy periods, such severe heavy periods that she couldn't leave the house. And she was just having to change her protection several times an hour, even overnight. And then within 2 or 3 hours of putting the SP6 on, she found that the flow abated, and she's found that to be extremely helpful. So the SP6 is marketed for reducing cravings, but it does help with overall hormone balance in many different areas. I'll just have a quick look at those questions because I think some of them were aimed at me.
And any aimed at me, Dr. Ali, please answer them as well.
Sorry?
Any that you find aimed at me, any questions, won't you please take over and on, because I'm not
I think we're mostly just praising you for keeping going. So there's just one about strokes. So when you're, and I want to reiterate this is really important. These products are not intended to treat, cure, diagnose, or ameliorate the symptoms of any disease. What we're doing is helping the body get to a position where it can heal itself. So we are helping the body to self-heal. And so when you have a question like, what should I give? What patches would be recommended for somebody with stroke? What you've got to look at is what the underlying problem is and treat that, and just go with your gut. And I always ask people to tell me what they think before I give any recommendations, because otherwise they're not learning to fend for themselves. They're always thinking, I'll ask somebody else what I should use. So whoever asked about the stroke, please put in what you would recommend. Marie Lou has got a daughter with long COVID. You put on X39, Eon and glutathione. That's excellent, Mari. Well done. X39, of course, is the one everybody needs to be on. Eon reduces inflammation, really important. And again, it depends what the symptoms are with long COVID. What I find in the long COVID clinic is that many of these people actually have chronic co-infections that haven't been symptomatic until they got COVID. So long COVID, in keeping with most other things, is actually a complex issue. And a lot of them, I was talking to somebody yesterday in the long COVID clinic who has severe muscle and joint pain. And for I would recommend the Eon, so that you've done that. Now, we also often find when we start doing more in-depth functional medicine testing with our long COVID patients, we often find there is a deficiency of glutathione. In fact, it's a very common problem generally. And so using the glutathione is very, very wise. If they also have additional brain symptoms, so if they've got brain fog or cognitive dysfunction, then it makes sense to add in carnosine, but we don't overwhelm them. These people are really sensitive. You'll find they're sensitive to medications. And they're also, if they're attending a long COVID clinic like ours, some of these patients are on about 10 medicines just from the long COVID clinic, which is it's less functional and more medicine, this clinic that I'm in. Albeit not wanting to overload their system, I think carnosine is a good idea if they're having brain fog. So no brain fog, excellent. That's really good. Does she have POTS, Mari, your daughter? Because that's we're finding very common in the long COVID clinic as well. Postural orthostatic tachycardia syndrome. Basically, they often have autonomic dysfunction, and they also often have histamine intolerance and MCAS, mast cell activation syndrome. Lots of things going on with these patients, as with chronic fatigue and anything like that. So Sakina's asking about whether it helps with allergic rhinitis and allergies. If you get hold of the patching protocol book, which is underneath this enormous heap of books I've got here. Oh no, that's post-reproductive health. That's not the patching book, it's just the same colour. But somewhere in that book, oh, is that it? I have about 20 books on top of it. In here, you'll find that there is a recommended positioning for sinusitis. So it's worth getting that. I think Dr. Jen has done an amazing job for us producing this book. Although I do want to hazard back to this, my starting point, that it isn't to treat illnesses. We want to be looking at the underlying cause. So someone's sent me a direct message by mistake instead of to the whole group, asking about nail fungus. So that is down to your immune system. So you want to correct the immune system. If you have underlying diabetes or insulin resistance, you want to be looking to that. So, and if you think about it, diabetics would benefit from all of the patches. In fact, when you really look at the detail, you will see that all of us would benefit from all of the patches. I use all of the patches except for energy enhancer. I only use energy enhancer about once a month. All the others I use. So our aspiration with this business is to be able to afford all of these patches and be able to take an income as well. So the stroke person. So L has got lupus. I'm sorry to hear that. I hope you have it only mildly. It can be a really complex problem. So lupus is an autoimmune disorder. So what do you think? Oh yes, she's asking if she can take the patches with the meds. There's no interaction with medications because these patches are non-transdermal. Okay, so there's no medicine interaction. They can sometimes cause a Herxheimer or detox reaction just because they're helping the body to heal, and sometimes that leads to bacterial toxins circulating in the blood, making you feel terrible, and that can last for a while. So if people are having a detox reaction, just ease up on it, use it fewer hours and then increase. But anybody with lupus, an autoimmune disease that's as severe as that, you would benefit from all of the patches. You'd benefit from Aeon, you'd benefit from X39, you'd benefit from carnosine for the brain, you'd benefit from Alavida for the collagen, you'd benefit from Ice Wave because I'm sure you have pain at times. And likewise for the person with stroke, the stroke could be hemorrhagic or ischemic, but we're talking about part of the brain dying. And so you want to be working with X39, obviously. You want Aeon to reduce the inflammation. You want carnosine for the brain and neurological side of things. You'll want glutathione to help with detoxification, because as Dr. Olufemi is always telling us, we are all walking around in a toxic state. We would all benefit from glutathione, but remember to use it gently. So Wes is saying their daughter, a 3-year-old daughter, was born with seizures, none for 2 years. That's great. Yeah, carbamazepine has been really helpful. So with that, again, we're not treating the seizures, we're not treating epilepsy, but you know that there's a neurological issue. You know that everybody would benefit from X39. So again, you really should be, where you're putting your questions here, tell me what you would recommend, okay? But you'll want X39, Aeon, and carnosine for the one with seizures. But of course, she's only 3, so you're going to be introducing these really gently. You'd probably want to use Aeon for 2 weeks before adding the X39. but they want to reach the point where you can add the carnosine as well. Dementia is that we've got some a great little video about age-related cognitive decline, because you're not allowed to call it dementia when you're talking in the same sentence as life wave. And I'm sure you will have access to that, or your upline will. And that's an important video to what brought me into this business, because my mum had dementia at the time. And that was with X39 alone. But knowing dementia involves the nerves, then you've got to think, well, that will probably benefit from carnosine. That will probably benefit from Eon to reduce the inflammation. That will probably benefit from glutathione to improve detoxification. So, yes, so let's make space for Graham and Brenda.
Yes, and there's also, thanks so much, Dr. Ali. I really appreciate that. I do, as I believe everyone else does. Just before we continue, also Sandy and Zarina, I'd like you to chat after Graham and Brenda. Everyone, if you're not on Telegram testimony group, and if you don't have Telegram, you have to get Telegram. That's the only way I can put it. It is so well worth it. I asked my friend SJ to please set it up for us. He's had a double liver transplant. The first one lasted 10 years. The second one started declining after 2 years. He's had it 6 years now. And we're not allowed to refer any of the patches to people who've had organ transplants. But he did his own research, and he's a ChatGPT tester. And he researched David, the company, the patches, stem cells. He chose to go onto X39. And he has extensive blood tests every single month. And in the first month, one of his liver enzymes dropped 100 points. That will make sense to Dr. Ali. Never happened in all the years before. But he had to go very slowly with it. So please get onto the Telegram testimony group. We've got people with Parkinson's, mental challenges, everything. And more than 160 categories and over 900 personal testimonies. Please go and look there. And please, as Dr. Ali said, post your own testimonies on that group or ask someone to help you, because it helps everyone. You can also find testimonies on Facebook and on YouTube. So thank you, everyone. Graham, won't you please unmute yourself and share with us? I think you've got two pieces of equipment in the same room. So if you mute the one. You may have a PC and a phone on Zoom. Graham, are you with us? I'll tell you what, Graham, while you sort that out, Brenda, won't you please unmute? Let's move on to you in the meantime.
Thank you. Good evening, everybody. I'm a newcomer to LifeWave, and I'm just so grateful because I've had can everybody hear me?
Yes.
Great. Because I've been a long COVID survivor. I was hospitalized 6 times in 1 year and was stuck with long COVID. And 2 years ago, when I relocated to Nelspruit, I was weak and I was told I would never fly again in my life and that I'll have to live on oxygen, and 50% of my lungs were scarred. So a friend guided me to a naturopath, Dr. Melinda Wessels, and her first words to me was, Brenda, God created the body to heal itself, but in order to do that, it needs assistance. And so I started the journey with supplements, and 2 years later, I thought I'm a totally new person, and I was so grateful. So when I
Connie, please.
So when I saw Liesel and her husband on Facebook with a patch, I immediately said I wanted to know what it was about. When I heard about the cost, I said, oh my goodness, can I drop all my supplements and use the patch? And not wanting to disrupt my relationship with Dr. Wessels, I contacted her immediately and asked her whether she knew about X39 and what she thought. She came back immediately and she said, brilliant. I'm also using it. And she's a cancer patient as well. So starting the journey with the patches, I said I first want to have a baseline so that Dr. Wessels can be aware of what's happening in my body as I take the X39. She was delighted when all my blood tests came out and said to me that I look like a new person compared to 2 years, but there's nothing for me to lose going the X39 journey. So I took photos the day I started it, and 5 weeks later, I couldn't believe the difference in my skin. And as I said to Liesel, because my body is, after 2 years, very high supplements and realigned my body, I wasn't really expecting large things out of the patching journey, except the principle of age regeneration and living healthy longer to do what God has called me to do. But what I have found was definitely my brain fog within the first month lifted. I needed to go and sleep about 3-4 hours an afternoon. And I thought it's not so bad because at least I'm not lying down all day long like 2 years ago. I'm 70, so maybe that's okay. Within the first week of taking X39, I couldn't sleep in the afternoons anymore. Even if I lie down, I will not fall asleep. And then the miraculous thing, I've not dreamt for years and years and years. And since I started X39, I am dreaming every morning, which to me is amazing. And then something that I didn't sign up for, over years, the last couple of years, I had no hair on my legs, except 1 or 2 long hairs here and there. So once a month, I would just quickly scrape with a razor when I'm in the bath. I would shake it on the bath edge, and there would be the 2 or 3 long hairs. And 3 weeks ago, I did the same, and oh my goodness, it was full of black stubble. And oh no, I didn't sign up for this, but this means something is happening inside of my body. And I'm really energized. I'm excited. And where I said, I don't want to do the business, I just want this longevity thing, I've now started to sign up people, because when you're so excited about getting more energy and I mean, even results like growing your leg hair growing, you feel you need to share it. So I'm really excited for the longer term journey, knowing that I've got to do it for a number of months to restore my sense of smell, which I lost long before COVID. Osteoporosis.
Hello, Mummy. Hello, Mummy.
Very severe osteoporosis after the high cortisone journey of COVID, and sleep apnea as 3 major things in my life that I'm trusting with long-term use of X39 and whatever else is recommended, that that the stem cell rejuvenation can actually add those positives to my life as well. So thank you to the family, and thank you especially to Liesel and France for humbly sharing your journey, which really invigorated me and is changing my life.
Brenda, I'm delighted that you shared. Thank you. And I work quite closely with Liesel at times, and Liesel in France were in Marrakesh with us. They also met Dr. Ali, and France came back. I've got to do this. So he is so excited about everyone. He's patching everyone and he's sharing, because that's what we do. Thank you, Brenda. Thank you.
I just
I'm
want
so
to.
pleased my fur has not been restored on the legs.
I just
You're the
quickly.
first one I've heard of.
I just quickly want to say the conference that I attended in December, France and he said to me, "You've got to
Stop
come."
With
saying,
Andy.
shut the fuck up, Brenda. Brenda, can you?
Even if you do not want to do the business, just come. And I must say, since I've been to the conference, I've been motivated to share, and I wouldn't have done so had I not been at the conference. So yes, I do think the events does support one in motivation to actually share what's happening in your own body.
Yes, thank you, Brenda. And I'm going to be talking about that right at the end. So we're going to finish with 3 people. Graham, you next. And then Serena, I'd like you next, followed by Sandy Perry. And then we'll close. So Graham, yeah, are you unmuted? No, can't hear you. Graham, let me see if I can unmute you. I'm going to ask, okay, ask to unmute. Try it now. No. Graham, you know, I'm wondering if it's in your settings, because you're unmuted and your camera's showing here. I think it's in your settings. So you know what, Graham? I'm going to move on to Serena. In the meantime, have a look at settings, come back, we'll get back to you, because I'm keen to hear what you have to share. Thanks, Graham. Serena. Where are
Hi, I'm here. I'm not
Oh.
on the camera, but I'm here by voice.
Thank you.
I had problems with my eyes last year, mid last year, and went for a consultation, and the doctor told me, Serena, it seems like your left eye has had a little stroke. And being a nursing sister, I was shocked. I'd never heard of a stroke in the eye. I thought there's generalized strokes. But now I know the medical diagnosis of it. Happily, I started X39, and when I went for my final checkup in December last year, my vision had improved by 70%. I could read beautifully and see beautifully what was around me. I still have a cataract in that left eye, but that hasn't impaired my vision. So I'm going in for a consultation next week for her to decide to do the cataract or not to do the cataract.
Wow.
That's my story.
Wow.
I'm so grateful that I'm able to see and I'm on top of it.
Geez, Serena, 70%. That's
70%
amazing.
vision, from no vision to 70%. I have a second testimonial. I had a rotator cuff tear on my right shoulder, also around September of last year, had physiotherapy and just never got success. Went on to Aeon and X39, and I can move my shoulder up, down, aside me, and I'm feeling good. I'm amazed that I don't have as much pain as I once had once upon a time. My upline, Sandy Perry, just is also amazed that my shoulder has improved so nice on Aeon and X39. I'm grateful for the use of the feedback. Thank you.
Serena, thank you. And can everyone feel it's gratitude throughout from everyone? And that's what we experience all the time. We're all living in gratitude. Thank you, Serena. I really, really appreciate you sharing, and I'm delighted with both your rotator cuff, which is a very difficult thing, and then your vision. Thank you. So, Graham, I'm going to move on to Sandy Perry, and then we'll close with you. Okay.
Thank you. Good evening, everyone. So Lifeway found me last year, August. In August of 23, I was just retrenched. And thanks to Ragini, who persisted in sending me information, to get her off my back, I asked her if you've got something for stress, because I suffer stress quite badly. And, an unexpected retrenchment created a lot of stress. I'm sure many of you had seen my picture in that state. And then 5 months later, having used the X39, the carnosine, Eon, I felt a difference in my body. I couldn't believe the transformation that came about in my appearance. And old aches and pains that I had disappeared. And an additional bonus was that I started sharing this with all my friends. Zarina, who just spoke now. And by default, I started doing the business, and that has brought in some income in our family. And I completed 28 park runs last year. And I enhanced using energy enhancer, and I'm now on X3949. So I'm grateful to X30, to Lifeway for the patches, and to everyone who's also shared their testimonies today. Thank you, Sandy.
Thank you, Sandy. And you know, Sandy, I saw your pictures before and after. Goodness gracious, big change, big change. Well done. People get younger. So, all good. Thank you. Graham, let's see now. Unmute. I can see you muted. Let me see if I can unmute you, Graham. Just trying to find you here. There's a Graham, A-E-M-E, but I don't see you, Graham, A-H-A-M. Okay, I'm going to, let's ask to unmute. Can you see that, Graham?
Sandy is unmuted, but there's no sound.
Yeah, Graham, I'm afraid, I think, have a look at your PC in the next day or so, because we'd really like to hear your testimony. And when we have a testimony Thursday again, please come on. Thank you. Thank you, everyone, for sharing. I find it extremely inspiring. I get totally enthusiastic about this. And that's what people feel. You know, it's our enthusiasm that they feel. They feel that before they hear and see anything. And I think it was, and it wasn't Sue, it was, anyway, one of the other ladies, yes, Brenda, you said the conference made such a difference. So I'm encouraging everyone in the Joburg area, and then also Milnerton, we've got a few places, PE, to join us with the virtual conference on Saturday. The Joburg people will be, have a look at the invites, and please book via the people. We've got quite a few people. I think we've got more than 50 so far for Joburg. I'll be there. I know Bridget will be there. A lot of us, Sandy Perry will be there. And we look forward to spending time with you. And you know, you'll feel the vibe. And Somberline and Kathy, I'm so pleased you're joining us. And we move from conference to conference to conference because it really feeds us. It does. So prepare to join us then. For those of you who can't attend conference in a group, please link in via the Zoom. Chris will send out the link. And then also there's another one with the company. This is it, Rise Up Conference. And then on the 25th, is the LifeWave Vision Conference. So I look forward to seeing you all there. Thank you, everyone. God bless and expect miracles. Wishing you a superb week and move with action. Thank you, everyone. Good night. Good night.